All right, let's dive right into this explainer. Today, we're exploring a genuinely fascinating frontier in clinical data, looking at what happens when you combine standard cancer treatments with a very specific, highly rigorous metabolic intervention. Basically, we're digging into a growing body of research that asks, can precision nutrition actually become a weapon against highly aggressive cancers? Specifically, we're going to examine recent, hard trial data on the medically supervised ketogenic diet, or MSKD, and see exactly how it performs when it's used directly alongside traditional therapies like chemotherapy and radiation.
So the big question right out of the gate, can a diet actually act like a targeted therapy? Now, to be clear, we're not just talking about general healthy eating or eating more greens here. We're looking at the mechanical disruption of a tumor's fuel supply. But to really appreciate the clinical results we're about to look at, we first have to understand the fundamental difference in how healthy cells and cancer cells generate their power.
To get the science, we really need to understand a massive vulnerability known as the Warburg Effect. Think of cancer cells as absolute sugar junkies. Because of some profound structural and functional abnormalities in their mitochondria, they are incredibly greedy for glucose. They ferment it rapidly to fuel their explosive growth and survival, essentially just ignoring the much more efficient energy pathways that your normal, healthy cells use every day.
And this brings us to a pretty brilliant concept. Researchers are testing if we can literally starve the tumor of its preferred fuel while nourishing our healthy cells with alternative energy, like ketones. You see, normal cells, like your healthy brain cells, are incredibly metabolically flexible. If you drop their glucose supply, they just switch gears and easily transition to burning ketone bodies. But cancer cells, because of their damaged mitochondria, they often lack the machinery to efficiently oxidize those ketones. So, if we drastically lower blood glucose and raise ketones, we put the cancer cells under immense metabolic stress, all while the healthy cells just keep humming along.
Okay, let's move to the actual intervention. The medically supervised ketogenic diet.
Now, we absolutely have to separate the popular internet keto fad from the intense clinical reality being tested in oncology wards right now. This is not a casual lifestyle choice. It's a highly controlled, medically supervised intervention utilized directly alongside standard cytotoxic therapies, and it absolutely requires continuous oversight from a specialized care team. In the trials we're looking at, patients used a continuous remote care intervention. They were tracking their daily blood ketone levels via finger sticks, aiming for a really strict target of 0.5 to 3.0 millimolar. They had to be in constant communication with dietitians and medical providers to ensure they stayed in deep nutritional ketosis while, and this is key, simultaneously receiving aggressive chemotherapy or radiation.
Let's get into the actual numbers. The data, metastatic pancreatic cancer trial results.
So, pancreatic ductal adenocarcinoma is a notoriously difficult cancer to treat. It creates these dense, oxygen-deprived environments that are just ravenous for glucose. Researchers wanted to see what would happen if they added this strict metabolic intervention to a standard triplet chemotherapy regimen. And honestly, the data here is striking. Patients who successfully incorporated the MSKD alongside their standard chemo saw clinically meaningful improvements in both progression-free and overall survival. And they did it without added toxicity. Just look at these numbers. Median overall survival jumped from 10.2 months in the standard diet group all the way to 13.7 months in the medically supervised keto group. Plus, progression-free survival improved by 3 full months. And incredibly, the MSKD arm didn't experience any increase in severe grade 3 chemotherapy-related adverse events. The diet-related side effects were pretty mild. We're talking fatigue, weight loss, constipation, and actually not a single patient stopped the diet due to those specific side effects.
Moving right along, let's look at the data for glioblastoma survival rates.
Shifting gears from pancreatic cancer, there's another prospective study that observed the effects of this ketogenic metabolic therapy on glioblastoma. Now, this is a notoriously aggressive primary brain tumor that almost universally relapses. The study set a really ambitious benchmark of 3-year survival, which is a massive milestone for this specific disease. And the contrast we see is honestly stark. For the group that couldn't maintain the diet, only 1 patient out of 12 reached that 3-year mark. That's just an 8.3% survival rate. But for the group that managed to stick to the strict ketogenic protocol for over 6 months, the survival rates jumped dramatically. 4 out of 6 reached or exceeded the 3-year mark. That is a 66.7% survival rate for the adherers, a total game changer for those patients.
But, and this is a massive but, out of the 18 patients in that glioblastoma study, only 6 were actually able to adhere to the dietary protocol long-term. This is the elephant in the room that we absolutely have to talk about. despite those incredibly promising survival curves. 12 out of 18 patients, literally a full 2/3 of the trial participants, could not maintain the intervention.
Which brings us perfectly to our next point, the adherent challenge, the big but.
So, why is the drop-off rate so incredibly high? And what does this mean for the future of metabolic therapies and cancer care? Well, the reality is that maintaining nutritional ketosis while going through aggressive cancer treatments is brutally demanding. It is physically and mentally taxing, and frankly, it's just not suitable or safe for every single patient. Think about it. You're asking patients who are already dealing with the trauma of a cancer diagnosis, plus the nausea, taste alterations, and sheer exhaustion of chemo and radiation, to drastically overhaul their entire relationship with food. It requires continuous, severe carbohydrate restriction, daily finger-pricking to track biomarkers, and dealing with potential gastrointestinal issues. Because of this, the current data strongly suggests that this intervention is highly effective, but really only for a specific subset of responder patients who are clinically and practically capable of sticking to such a rigid protocol.
Now, I need to pause here and heavily emphasize something crucial. Attempting this on your own can be flat-out dangerous. This explainer serves strictly as a community-built resource to connect you with emerging research, not as medical advice. Because this kind of diet can cause drastic shifts in your blood sugar, weight, and overall metabolism. Doing this without a specialized clinical team while undergoing systemic cancer treatments could lead to really severe complications.
If this data gives you hope, and it certainly is hopeful, the absolute best next step is to bring these specific trials directly to your medical team. See if you might be a candidate for a medically supervised approach. It's all about combining forces. The goal of this research isn't to replace your standard treatments. It's to explore how complementary cancer care, properly integrated, might just boost your body's response and improve long-term results.
As the clinical data continues to evolve, it really leaves us wondering, are we entering an era where medically supervised precision nutrition becomes a standard pillar of cancer care? I mean, if we can reliably identify which patients can tolerate and respond to these rigorous metabolic therapies, could manipulating a tumor's fuel source become just as standard as surgically removing it? It's an absolutely fascinating frontier in oncology, and it's one we're going to be watching very, very closely. So keep exploring, stay curious, and as always, discuss every new piece of information with your healthcare team.